Got our closer coming in, Dr. Luke Beggs. He's going to talk on pre-participation exam considerations. So Dr. Beggs is a non-op sports medicine physician at Norton Sports Health Orthopedics downtown. He's the co-medical director for jockey care at Churchill Downs. He attended medical school at the University of Kentucky, completed residency in family medicine and a fellowship in primary care sports med. Prior to his medical experience and medical education, he also completed a master's and a PhD in exercise physiology. So without further ado, we have our closer, Dr. Beggs.
All right, so I'm going to finish out today where a lot of sports medicine starts, the pre-participation physical exam. I'm going to do kind of some big picture things and not really trying to teach you how to do a in-depth PPE. So PPE, or pre-participation physical exam or evaluation, or the sports physical, and here's kind of some objectives. We'll just keep moving here. So our goal with the PPE is important to kind of state preemptively and think about, if what we're doing is actually achieving that goal. So we really want to maximize safe participation in sport. For athletes, try to identify medical problems that they might have that need to be addressed before they start their sport. But this is not a uniformly standardized thing. This is not something that's done the same way every organization, every place in the country. Certain sports, certain leagues have their own sort of questions. Even within the same division, you might have different schools doing a few different things. The content and sort of usefulness of the PPE is a little bit debatable if you kind of put it under the lens of research and say, does doing a PPE across the board actually achieve this goal of, decreasing, illness, even death associated with exercise? It's kind of hard to sort of prove that in research. We'll touch back on that. The PPE or sports, physical it's not the same as the comprehensive health maintenance visit. Your annual physical you might get with your primary care provider, but for some, athletes in this kind of age group, this might be the only time that they're really seen by a physician. History is really important with the PPE, although physical exam or evaluation is sort of in the title. A lot of problems can be found just on history alone. So when I'm doing one with an athlete, there's usually a form that we'll look at here in a second that they've filled out ahead of time. And the first thing I'm doing is going through that, clarifying, any answers that they might have put in as a yes to some of these questions. Ideally, that form is filled out ahead of time and maybe with parental input if it's especially a younger kid, but even college aged. I know that I even have a hard time when I'm, seeing a new doctor or something, thinking through health history and, family medical history, when did this thing happen or when was that surgery? So you can imagine a 18-year-old really struggle with that. If you don't know, where to even begin with these, there's plenty of examples, templates online. The one I'm going to show you is from the AMSSM, which is sort of the big organization for primary care sports medicine, which is what I do. It looks like this, sort of your basic health history form, intake form, but with questions specific for things that are important for sports, things we want to know about. I have a much longer version of this talk that I'm not going to do that sort of goes through these questions, one by one, and talks about why we're asking that, what medical conditions we're thinking about. I've included that with what I uploaded here that's sort of at the end of this talk, if anybody wants to look at that later. And here's the rest of that. You're signing off at the end. Important to, note this blank area with lines there that's, explain any yes answers. That can be missed by the athlete, but that's, just because they answer yes doesn't mean automatically they're not going to get to play their sport. That's sort of just the jumping off point that we're going to open that conversation and say, oh, tell me what you mean by, you get lightheaded during exercise, things like that. So kind of first main point, physical exam, sort of in the name, but the history in some cases is the most important thing. So as I kind of alluded to, the PPE or sports physical, under the research lens is maybe not been well proven to be an effective screening test if we, kind of put it up to the same standard as our other sort of medical screening tests, that are often recommended by the USPSTF, things like your colon cancer screening, your mammograms. They probably don't meet some of those same criteria. Some studies that are, a little bit older at this point, but have shown that there was no effect on the overall morbidity and mortality, in athletes when they were looking at the current recommendations for a PPE. It does not meet the basic requirements for the screening set by the USPSTF, and so, does screening PPE actually change clinical outcomes for athletes? But I would argue that, we need to make 2 points here. Just because we have not shown that the sports physical, actually has evidence for it being beneficial does not mean that it is not. It just means that the science maybe isn't there. Science is hard. It's really hard to do something, like prove that a PPE, works works in terms of decreasing, maybe something like athlete death. You're talking about something that's a very rare occurrence. It would take millions of dollars to have a randomized controlled trial where you had one group that, all underwent sports physicals, one that didn't, and sort of tried to compare those, things that happen rarely and happen over time. And so that study's not going to be there. So we rely on other types of research, and it's really hard to sort of prove that something, does work in that way. So even though I'm, maybe making it sound like a sports physical is not, as good as what we would hope, I do want to challenge anybody that's involved with these or doing these, not to just check the box, not to just say, okay, we got this many athletes coming through, how can we get through these, get all the papers signed, to really instead think about how we're doing this, how can we make it efficient, how can we ask the right questions, are there questions that maybe we need to drop off of our sports physical or PPE, and or things that we're doing, in the physical exam that, we're just doing it because that's what somebody showed us to do, and actually why are we even doing that test? Don't fall into this trap of, things we do for no reason. So some barriers to doing a sports physical, figuring out what setting it's going to be in. This is often done for schools with these like mass physical days where you've got a bunch of kids coming through in an open gym, and you've got a bunch of, docs there, athletic trainers on hand, physical therapists, everybody kind of pitching in to get through the different steps for that. That's one way to do it, and I think there is some benefit to that. But in the office with a maybe pediatrician or primary care doc that knows the athlete well, that is another reasonable way to get this done. And as long as the practitioner is comfortable asking those questions and knows what they're looking for, I think that can be a really beneficial way to do it as well. Ideally, it's done before the season starts with enough time to actually follow up on anything that you may uncover, but that's not always the case. I've done physicals in the parking lot of the baseball field for an athlete that just came into town and needed that paper signed and things done so he could then practice or play that day. Not ideal, but sometimes what we do. I mentioned health history, recalling all that on the spot is hard, so filling that out ahead of time. It's sort of a interesting thought experiment that, if you had all the time in the world, all the money, what all sort of tests beyond just our questions, would you include it in, perfectly ideal sports physical, maybe a more, thorough cardiac workup would be a big one, ECG, echocardiogram, stress tests, but, baseline concussion testing, and then, that they're always done by someone that the athlete already knows and trusts to talk about some of the screening questions. But practicality, comes into play, cost, access to these things. We definitely don't want to limit someone's participation in sports or athletics just because they don't have access to getting a physical done. I hate to see the kids that come in that, it's really hard for their parents to get them to that location or, to pay for, an office visit. and that's the only thing holding that kid back from being able to play sports. I would say, especially with that questionnaire, but also with the physical exam, be prepared to do something with that information that you're getting. Especially, think about, if they answer yes to this, if I find a positive test here, what's the next step going to be? If we have that in place ahead of time, it's a lot better for the athletes. So especially for any like athletic trainers out of school, know your resources if you're new to that school or area. If we're asking mental health screening questions, know who your resources are to refer them on to next. Don't sit there with an athlete that says they're depressed or something like that and then say, well, okay, I guess we'll have you see somebody in the next few weeks. Know who you can call. Same thing with nutritionists, cardiologists especially. A lot of these sports physical questionnaires will include questions about mental health and nutrition now, which I think is great that we're addressing that. But kid new on campus, freshman coming in, that's just excited to be there and get started, maybe isn't the best time, or shouldn't be the only time that we're screening for these kind of things. So yeah, how will this change your management? When I was doing residency and especially in the hospital, attendings would ask this question a lot about any tests we were going to order, and it really sort of challenges you to think about, is this a necessary test? And if I get it back and it's positive, what are we going to do next? So it's good to have a systematic way of doing a sports physical so you don't forget something, but definitely tailor it to the athlete. On the left here, dunking, this was an athlete that came in when I was in Memphis. He was a freshman, 17-year-old man-child coming in to play for a year to go on to the NBA where he's at now. And he had just turned down, I think, something like $1 million to play overseas. Probably says something about the NIL money that he was getting. But he's standing in front of me, 6'10", that I'm supposed to do his physical and do his musculoskeletal exam. And I'm somebody like that. I'm definitely listening to their heart. He fits a certain demographic for some of the athletes that can have problems there. But am I really worried about his strength when he's just left the court doing that? Versus an athlete that maybe it's the first time they've ever played sports. Maybe it's the first time they've ever really been active. Their body has never been challenged in that way, and you may uncover some more things there. So I'm a orthopedist by day, but trained in family medicine first. As much as I love the musculoskeletal system, it's maybe not as important in this setting of the sports physical. It's probably where I try to spend a little bit less time, because I can't really think of a time that I've ever said that an athlete couldn't go on to play based on something on the musculoskeletal exam. Certainly if they've already got an injury, they're usually already seeing somebody or involved in physical therapy, and maybe they've got to work through that. But there are a few circumstances where I'm doing some specific things depending on their sport. Thinking about the female athlete, soccer player with poor knee biomechanics, or the baseball player with internal rotation deficit. But a lot of these kids, while they're waiting their turn, they're already running around playing. They just maybe left the weight room to come in, and now I'm checking the strength of their shoulders and grip strength, and I'm kind of thinking to myself, what do I really expect to find here that's going to change what we're doing next? So not maybe the best place to spend all of our time. And to kind of further drive home that point, this was an athlete that I did a physical for, a freshman at Bellarmine. Kind of amazing story there, and he's not alone, but he was born with a syndrome that one of the things associated with it is limb deformities, and he's got a limb difference. As you can see in his right hand there, he's been through multiple surgeries, but despite all that and having minimal function of his right upper extremity, he is playing baseball at a collegiate level. He made it here with that. So am I going to do a physical exam on that extremity and change something there? So he actually, if you look at his glove, there's a technique that they use. He's got his glove around backwards, so he has to pitch with his left hand and then flip his glove over also to his left hand to catch. So in a syndrome like that, I'm definitely actually on the spot was getting out my phone, looking that up, like, okay, what other health problems are associated with this? Of course, he had been, seeing his entire life all these subspecialists, but he was, new to this area, and so if we needed to identify anything that needed to be followed up on, that's a good time. I would say cardiovascular exam, as far as the physical exam, is much more important than the musculoskeletal. The overall incidence of sudden cardiac death in young competitive athletes, 1 in 50,000 to 100,000. If you consider all the young athletes competing, there's going to be some sudden cardiac deaths despite our best efforts. This is one of those cases where there is a paradox with exercise that we think of exercise as good for almost everything, but there are some cardiac conditions where it may increase your risk of death. Sudden cardiac death is the most frequent cause of medical death a medical cause of sudden death in athletes. One of the big conditions associated with that is hypertrophic cardiomyopathy. The other one being anomalous origin of coronary artery, and there's a few others, but those are two big ones that you're thinking about. And so going back to that template, there's specific questions trying to get at that underlying, cardiac problems that maybe haven't presented yet. Unfortunately, the most common presentation of these cardiac abnormalities is sudden death. They've been asymptomatic, and the first time that they have any problem is, when they die. But there are a few things that sometimes we can pick up on and try to catch these cases and do something about it. A big one is, passing out during exercise. That's something you really want to clarify if they passed out actually during exercise or immediately after. If you've ever been at, like a cross-country meet or something, or the Ironman in August coming up here, like passing out right after you stop, that's one thing, but passing out just while you're running is completely different. If there are concerns from your cardiac exam or from that history, get follow-up testing, especially if you're at a place that doesn't do baseline ECGs for everybody. That's something that some places do across the board in certain countries. Every athlete is getting this baseline cardiac workup. Some schools do that, but I would not feel bad about if you have any worries there about getting these other tests that are just actually standard of care in some places. And because of some of these cases of kids having this that were not picked up, there's a lot of foundations out there trying to push for how do we get everybody at least an ECG done ahead of time. Family heart health questions are also important in this. I kind of didn't realize this, but until I was putting this together, I knew it was a lot, but I didn't realize the prevalence of hypertrophic cardiomyopathy is about 1 in 200 to 1 in 500 adults. So we've got about that many people that have been here today, 200 or so. And this is something that is autosomal dominant and familial, so about a 50% chance of somebody's, if they have it, their kid having that. Actually, maybe the same day doing physicals at Bellarmine, there was a kid that had, I think, a father with hypertrophic cardiomyopathy, and maybe his brother had actually passed away from it. He had already had the full workup because of all that. So, but I still felt a little bit nervous, putting my name at the bottom of his sheet just because of that. But he had all the workup you can have. This isn't the best slide. I'm not a cardiovascular expert, but a heart murmur is one of the big things we're looking for on exam. There are a lot of different types of murmurs. You can really get into the weeds with that, but it takes a lot of practice to get good at differentiating some of those. The two big categories we think about are systolic and diastolic murmurs. The hypertrophic cardiomyopathy murmur is described as this harsh crescendo, decrescendo, mid-systolic. I mean, that's you got to have a really good ear and be very used to listening to murmurs to be able to describe something in that much detail. But I would say any diastolic murmur usually is going to be abnormal. Any systolic, it can be a normal thing. Actually, up to 72% of kids will have a murmur at some point in childhood. But another story, I think this was at Hanover, end of the day doing physicals. The kid had, I think, driven through the night from Georgia to move there with his parents. You know, we were just about to leave. Oh, can you grab it? Can you do one more physical? Okay, let's just get it done quickly. And I listen, and he's got a murmur. You know, okay, let me listen again. Let me listen closer. I was like, you know, have you ever been told this? Nope, no history. You know, like, okay. And it was a loud murmur, and a 18-year-old, probably, normal. It didn't sound like one of the worrisome type, but I was like, man, we're going to have to work this up more. You know, you're 18 and got this really loud murmur. So it would have been easy in that instance to just kind of quickly listen, check the box, move on, but here we are. I hate to end the day on such a morbid note, but just to really drive home why these sports physicals, why this cardiovascular screening kind of thing is important. We do not have to look far to see some really tragic cases of athletes that are dying while playing sports that maybe all the screening tests in the world would not have picked this up, but maybe it would have. And I'm sure that these kids, parents would argue that they would have much rather somebody done more workup on their kid, even if it costs a little bit more ahead of time. And this is not just young kids, not just low-level sort of competitiveness. This has happened even in professionals. I think LeBron James' son being a big example in the last year or two. All right, we'll finish there. If you didn't get anything out of today, I hope you're sticking around, because you can still get something out of today with getting to have a mint julep on Millionaires Row at Churchill Downs. So. Yeah, thanks.